I am Maricette Hassan, Program Coordinator for the South Carolina Coalition for the Care for the Seriously Ill. I want to welcome you today to our virtual symposium. Today, Alexis is going to share with us about veterans and the eligibility for hospice benefits. So, Alexis, you're in good company, and I'm going to turn it over to you now. Thank you again.
Thank you for having me. The eligibility, enrollment, and vesting. So in order to be eligible for VA medical services, the veteran must have been discharged or released under conditions other than dishonorable. The first thing that a veteran should do to see if they are eligible is what's called the application, the VA Form 1010-EZ. Okay, this can be done in person at a VA facility, whether that be here at the Ralph H. Johnson or any of the CBOCs, like there's one in North Charleston and Goose Creek, or they can call that number and speak to a representative, and they can walk through that with them. And again, look at the on the slide, it will also give you how to do this form online. So, here we go. You may be eligible to enroll in the VA healthcare if you served in the active military, naval, or air service, including being called up from the National Guard or Reserve by a federal court, and you didn't receive a dishonorable discharge, and you meet at least one of the service requirements for enrollment. And here they are. You served at least 24 months in a row without a break. That's what's called continuous. Or for your full active duty period, or you were discharged for a service-connected disability, or you were discharged for a hardship, or what's called an early out. Or you served before September 7th, 1980. So what is needed to apply? So whether we go the route starting with the 1010, what they're going to be asking for. Social Security numbers for you, your spouse, if you're married, and any dependents that you may have. They're going to ask if you have any insurance card information for all health insurance companies that cover you. This includes any coverage that you get through a spouse or significant other. And this also includes Medicare, any private insurance or insurance from your employer. You can also provide your military service history information, any details about exposure to toxins and hazards, because this is, that information often gets looked at to see if a veteran can get what's called a service connection disability. And that includes a monetary compensation each month. You can also bring, and they may also request, a copy of your DD-214. The reason I'm telling everybody all this information is if you work with veterans, it's wonderful to have this information ready for them if they are interested in accessing some medical benefits from the VA. These are the things they're going to need to provide. So a copy of DD-214 or other separation documents. Income information for that veteran, for their spouse or any dependents that they may have. And again, that includes income from a job or from any other sources, and deductible expenses. So that's expenses that they can subtract from their income for them, for their spouse. Those expenses will lower the amount of money that we look at to consider income. Additional benefits for our hospice patients, we have a caregiver support program. That includes education, outreach, peer support, mentoring, skill training, coaching, telephone support, and online programs. And up on the screen is the support line. Comprehensive services are the enhanced clinical support, monthly stipend, counseling, and beneficiary travel. Okay, so what this is saying is if one of our hospice veterans is 70% service connected or higher, their caregiver, their wife, their adult child, their whomever, may be eligible for a monthly stipend, monetary stipend to help take care of that veteran in their home. Okay. Again, it's that 70% service connection or higher. Keep in mind, these are so important because this is extra money for the veteran and these families. Okay. Some people have to leave their jobs to take care of somebody. So it behooves any veteran to become part of our healthcare system. They do not have to receive all of their healthcare from us, but if they become part of our system, there's so many things that they can be offered. So these are some of the things that fall under that caregiver support program. So the eligibility, the ADL need for 6+ months, functional impairment that impacts personal safety. So this program expanded from the post 9/11 veterans to pre-May 7th, 1975. And then the program expansion to veterans of all eras expected happening October 1st, 2022. Here is a link if you wanted to get more information on the program. For those caregivers to be able to get monetary compensation or even just the support from other people that are working with veterans in the home. So the building community connections for the veterans, oftentimes if they are under hospice, they're not part of our system, we can look to try to expedite that enrollment and get that initial vesting appointment quicker because of the hospice need, right? So again, if we have somebody that's on home hospice and we find out that the family it's just getting to be too much and placement would be helpful. Well, if they're not part of our system, there's a process now. They still have to go through the vesting appointment. So the VA structure has really these three parts: the Veteran Health Administration, the Veteran Benefits Administration, and the National Cemetery Administration. What they have in common, they all have the need, if a veteran is going to try to get access to any of these three, they all have the need for the DD-214, which are the discharge papers for that veteran. They're all going to ask for that discharge paperwork. Okay, the Veteran Benefits Administration, that middle section. So the veterans do not need to be enrolled in VA healthcare to receive those benefits. Okay, and we see under that, we've got the survivor benefits. So to qualify for some of that income after a death, the death must have resulted from a service connection condition or related to one. So the importance of knowing a veteran service connection disability and documenting on the death certificate as a cause of death or an associated or contributing condition, if applicable, that is what ties the caregiver, the wife, the spouse, whomever, to being able to receive something financial after a veteran dies. There is also education and training benefits. Again, this falls under this middle section, Veteran Benefits Administration. So education and training benefits, there's something called the Yellow Ribbon GI Bill for qualifying dependents, and housing grants or assistance for those who qualify. And those are just a few. So under National Cemetery Administration, we've got the headstone and marker that can go to a veteran at the gravesite. Again, do not need to be enrolled in VA healthcare to receive that. So military funeral honors, that means the military men and women that come to the gravesite and they're dressed in uniform and they present the flag, those kinds of things. Presidential memorial certificates, right? Signed by our president, thanking them for their sacrifice. A burial flag, and potentially a burial allowance. So the maximum for service-related death can be up to $2,000 toward that, and non-service-related death up to $300. Thank you for your attention and for all you do for our veterans.